Hi everyone, I'm Jennifer from the Healthcare Program. Today I'm going to present some details on my final year project. The topic of my project is a survey on Hong Kong people's understanding on Chinese herbs used for treatment of hair loss. First, I will start by introducing you some backgrounds and the objective of my project. Hair loss is a common yet depressing symptom, especially for the elderly and middle-aged populations, which affects people's appearance and their self-confidence, reducing their quality of life. Traditional Chinese medicine, TCM, can show a significant effect on the treatment of hair loss without notable side effects. However, Hong Kong citizens' level of understanding on the use of Chinese herbs in the treatment of hair loss is still unknown, which may lead to increased risks of misuse of the appropriate herbs, thereby threatening the health of the citizens. Therefore, this study aims to investigate and provide more quantitative information regarding Hong Kong citizens' level of knowledge on the respective Chinese herbs used for the treatment of hair loss using a survey questionnaire. Now, I will move to the part of methodology. This survey was a cross-sectional study, and simple random and snowball sampling method was used for selections of the survey respondents. A self-administered online questionnaire containing questions with prescribed answer options was distributed to the respondents. The questionnaire contains two parts. The first part collects respondents' demographic information, including their gender, age group, and educational level, while the second part, a yes or no questions, which attempts to assess the knowledge of the Chinese herbs used for treatment of hair loss. This is the sample of the questionnaire. An expert validity test had been conducted prior to the main survey to examine the validity of the survey approach, in which 7 professionals were invited to validate the 5 knowledge-related questions of the questionnaire. The average THEi for the whole questionnaire are 0.94, showing that the questionnaire could be used as a formal questionnaire. Then, let's move to the results of the project. The questionnaire used a scale ranking of 1 to 5. The number of valid questionnaire received was 339. The demographic data included in this survey were gender, age group, and educational level. This table shows the distributions of the respondents' demographic data. We can see that while the number of male and female subjects was similar, the age group of 18 to 39 and the respondents whose education level was undergraduate or above constitute the highest proportions of the total. Among the 339 respondents, the mean score of the sample population was 1.53. In addition, from this bar chart, we can see that there were a large number of respondents choosing the answer no for the 5 knowledge-related questions. In terms of the level of understanding of the Chinese herbs included in the questionnaire, there was no significant difference between the mean score of male and female subjects. The mean score of subjects aged 60 or above was significantly different from that of the subjects aged 18 to 39 and that of subjects aged 40 to 59. But there was no significant difference between the subject aged 18 to 39 and those aged 40 to 59. The mean score of undergraduate or above group was significantly different from that of secondary school group, but not the below secondary school group. There was also no significant difference between the groups secondary school and below secondary school. To conclude, since there is still uncertainty about Hong Kong people's understanding on the Chinese herbs used for treatment of hair loss, which may bring potential harm to them, the result of this study is expected to provide more quantitative information about their knowledge level of the respective Chinese herbs. Although the results of this study suggest that people who are younger or having higher educational level seem to have somewhat better understanding on those Chinese herbs, the low mean score pertaining of the knowledge of the 5 Chinese herbs also suggests that the respondents were actually not very familiar with these Chinese herbs. Therefore, it is recommended that more promotions on the use of TCM should be conducted through different channels to further increase Hong Kong citizens' understanding regarding different knowledge of TCM, thereby promoting the use of TCM to treat the hair loss problem of people in Hong Kong. This is the end of my presentation. Thank you very much for listening.